Health data blocking has long been a silent barrier to patient care, innovation, and transparency, and it's about to face a reckoning. Today, the U.S. Department of Health and Human Services, HHS, declared an all-out crackdown on this harmful practice, signaling a major shift in how the government protects patients' access to their own medical information. But here's where it gets controversial. While the initiative aims to empower patients, it also puts healthcare providers and tech companies under intense scrutiny, raising questions about compliance, costs, and unintended consequences. Let's dive in. Under the leadership of Secretary Robert F. Kennedy Jr., HHS is ramping up resources to enforce penalties against healthcare entities that restrict patients' access to electronic health information. This move builds on the 21st Century Cures Act of 2016, which granted the Office of the National Coordinator for Health IT, ONC, and the HHS Office of Inspector General, OIG, the authority to hold violators accountable. But why now? The Biden administration largely sidelined this issue, but the Trump administration and now Secretary Kennedy have made it a priority, framing it as essential to modernizing healthcare and fulfilling the promise of making America healthy again. Deputy Secretary Jim O'Neill put it bluntly. Unblocking health data isn't just about technology. It's about transforming how we deliver care. For patients, this means more control over their health records, whether to monitor chronic conditions, verify treatment plans, or track progress in wellness programs. And this is the part most people miss. When patients can't access their data, it's not just an inconvenience, it's a barrier to better health outcomes. Acting Inspector General Juliette T. Hodgkins emphasized the legal stakes. Providers and health IT companies have a duty to ensure information flows freely. We're not just investigating violations, we're enforcing the law to protect patients. Meanwhile, ONC's Tom Keene revealed that his team is already reviewing reports of data blocking and assisting the OIG in investigations. But here's the twist. While the focus is on holding bad actors accountable, some argue that overly aggressive enforcement could stifle innovation or burden smaller providers with compliance costs. What do you think? The Trump administration's push began with the ONC Cures Act final rule, which mandates that patients should access their electronic health information, EHI, at no cost, even via third-party apps, and that providers should have the freedom to choose digital tools without excessive barriers. Today's announcement doubles down on these principles, warning violators of steep penalties, including fines of up to $1 million per violation for health IT developers and potential exclusion from federal programs for providers. Here's the call to action. If you've experienced data blocking as a patient, caregiver, or innovator, report it through the ONC's information blocking portal, healthit.gov/report info blocking. For healthcare providers and tech companies, the message is clear. Comply or face consequences. But as HHS tightens the reins, one question lingers. Will this crackdown truly liberate health data, or will it create new challenges for an already strained system? Let us know your thoughts in the comments. This is a conversation worth having.